The AccessShare project seeks to co-design data access and sharing mechanisms with blind individuals, addressing the lack of accessible data inspection and control mechanisms for this community. In a study involving 10 blind participants, researchers employed smart glasses and an AI-infused application to collect image data in participants' homes. This novel approach enabled the collection of nuanced, real-world data. The study introduced the AccessShare interface, a bespoke data access mechanism designed in collaboration with the blind community. Through a co-design approach, researchers engaged in iterative discussions with participants to understand their needs, preferences, and concerns regarding data access and sharing. This collaborative methodology ensured that the AccessShare interface was tailored to the unique requirements of blind individuals. The AccessShare interface was designed to provide users with fine-grained control over data access, enabling them to inspect and manage their data with precision. The AI-infused application supported this process by providing real-time object detection and recognition, facilitating the identification and categorization of collected image data. The study's results highlight the importance of co-design in developing accessible data access mechanisms. By engaging with blind individuals throughout the design process, researchers were able to identify and address critical accessibility barriers. The AccessShare project demonstrates the potential for collaborative, user-centered design to improve data access and sharing for marginalized communities. In this study, 10 blind participants made decisions about sharing their study data using AccessShare, a novel interface designed to explore potential functionalities for accessible data sharing systems. Situated within a participatory data stewardship framework, the research examined how participants formed, communicated, and evolved their decisions. The findings revolve around two key axes: blind participants' data sharing decisions and requirements for accessible data sharing systems. Most participants chose to share their study data, citing the absence of personal information and people in the background as a common reason. However, manual inspection revealed instances of personally identifiable information in their photos. The study also found that obtaining written data sharing consents via email after data collection was ineffective, with most participants opting for verbal consent during the co-design session. This highlights the need for an interactive approach to consent. The findings emphasize the complementary role of data access systems like AccessShare in facilitating communication with sighted people, such as data stewards and family members. This research contributes to the field by providing empirical findings from a real-world participatory data stewarding process with blind participants, reflecting on decisions formed and how they were communicated. It also implements AccessShare as a probe for co-designing accessible data sharing systems that facilitate control among blind data contributors. The study offers insights into challenges and opportunities for meaningful informed consent for blind data contributors. The importance of participatory data stewardship is emphasized in addressing the practical challenges of data control in AI, particularly in light of regulatory interventions like the GDPR. By engaging blind people in contributing to datasets for AI innovation, this research highlights the benefits of disability-first data collection efforts and the need for accessible data sharing systems that prioritize individual agency and control. Participatory data stewardship models have been explored across various fields, presenting opportunities and challenges. In the medical space, data donation has been frequently discussed, where individuals voluntarily contribute their health data to a federated dataset for broader societal and collective benefits. However, critics have pointed out that the datasets exhibit self-selection bias, resulting in a lack of representation from minority groups. Data cooperatives have been introduced to facilitate the development of systems and processes that explicitly allow people to gain control over their data. In the context of accessibility, there is a growing need for data to facilitate novel assistive technologies. Photos of everyday objects captured by blind users can contribute to building image recognition applications to access visual information. However, balancing the benefits and unique risks of accessibility datasets is critical. There is a rich body of work related to photos sourced from blind people for AI datasets, but conscientious data stewardship practices are essential, emphasizing a disability-first approach. The authors build on this call through a case study with the blind community, focusing on the involvement of blind people in the creation of a teachable object recognition dataset. They discuss efforts toward conscientious data stewardship practices, emphasizing a disability-first approach. The authors also introduce AccessShare, a design probe that incorporates automatically generated descriptors in an HTML web page, enabling blind users to navigate, access, and inspect their data. The probe is closely tied to the data collection task, which involves training a teachable object recognizer. The design probe is designed to facilitate discussion and ideas for an accessible data sharing system that can support data control. It provides a navigation menu, a page that provides a summary, and a grid view of the photos with alt text based on descriptors for the selected data. The authors will later discuss the probe with blind participants to brainstorm ideal functionalities and features. Researchers have developed AccessShare, a novel system that facilitates data inspection and sharing for blind users in AI-driven object recognition tasks. By leveraging automatically generated descriptors, AccessShare provides an accessible interface for users to review their collected datasets before deciding on sharing them. These descriptors capture various aspects, including the number of objects detected, image quality, privacy concerns, and object framing. The interface, built using the Jinja web templating engine, features an accessible HTML design with alt text for photos derived from the descriptors. The navigation menu is organized into a two-level hierarchy, with primary options for training data and testing data, each leading to secondary menus with links to specific content. The file structure is based on user-added object names during training, with testing photos assigned to objects based on recognition outputs, which may require manual review due to potential misclassification. A participatory approach was employed to understand blind users' desired level of data access and control. In a cross-sectional study, 10 blind participants evaluated an object recognition app on smartglasses and then engaged in a data sharing session using AccessShare. This setup allowed researchers to capture participants' decisions, feedback, and concerns on data sharing, privacy, and potential improvements for future data collection and sharing frameworks. The study's findings aim to inform future frameworks, aligning them with the needs and expectations of blind data contributors. By providing an accessible interface for data inspection and sharing, AccessShare enhances the quality and diversity of datasets used in AI-driven object recognition tasks, ultimately improving the performance of these technologies for all users. The authors of the research paper detailed the co-design methodology behind AccessShare, a system designed to empower blind individuals with the ability to inspect and control their study data. This system was developed through collaboration with 13 participants recruited via a mailing list, the National Federation of the Blind, and word of mouth. 10 participants chose to engage in the co-design process, which was approved by the institution's review board. Participants were compensated at a rate of $15 per hour for their involvement. Data collection began with a 30-minute Zoom call, during which participant demographics, attitudes towards technology, and their experience with it were captured. Following this, participants took part in a system evaluation from their homes, remotely connecting with researchers to perform various data capturing activities. A week later, they participated in a remote semi-structured interview to discuss their motivations and concerns regarding sharing their study data. At the conclusion of the interview, participants were emailed and asked to decide whether they wished to share their study data via a public AI dataset. The co-design process aimed to identify methods for granting data contributors greater control over their data. Participants were invited to a follow-up session where they utilized AccessShare to inspect their study data and collaboratively designed ways for blind data contributors to access and manage their data. The ongoing analysis of the assistive technologies evaluation falls outside the scope of this paper. Demographic information about the participants includes age, gender, education level, occupation, and familiarity with AI. The participants' vision levels ranged from totally blind to legally blind, with an average age of 53.46 years. The data collection activities involved evaluating a teachable object recognition app deployed on smartglasses in their homes, where they took photos and provided labels for 6 objects. This study examines the accessibility of data sharing and control for blind participants, involving 20 individuals taking photos of objects in their homes. The photos were labeled and stored in AccessShare, an accessible platform allowing participants to share their study data with others. Co-design sessions were conducted to gather feedback, comprising hands-on interface exploration and guided discussions. During exploration, participants navigated AccessShare, finding object labels, reading summaries, and describing photos. The discussion component elicited reflections on data access experiences, providing insights into potential improvements and features for AccessShare. Inductive thematic analysis was applied to participant feedback, involving descriptive and interpretive coding. This process identified themes related to decision-making modalities, alternative data sharing methods, descriptors, trade-offs, and potential features and capabilities for AccessShare. The study also analyzed participants' decisions regarding data sharing, mapping these to the presence of personally identifiable information, PE, in their photos. A codebook was developed to annotate PE, categorizing them into object and text categories. The comprehensive approach aimed to understand how blind participants perceive and interact with their data, highlighting the importance of accessible data stewarding processes. The findings provide valuable insights into the development of inclusive data sharing platforms, emphasizing the need for user-centered design and accessible data control mechanisms. In the AccessShare study, researchers categorized personal identifiable information, PE, into object and text categories, including subcategories such as face, photo of face, and letter. Utilizing the VGG annotator tool, 2 researchers annotated 3,060 participant photos each, achieving strong agreement on the presence of objects, like face, kappa equals 0.89, and moderate agreement on text categories like letter, kappa equals 0.73. Disagreements were resolved through discussion, and a new category, other flag, was introduced to account for potential nationality disclosure. The study found that participants' decisions to share their study data were influenced by the presence of PE, with some opting to share despite having photos with recognizable faces. Figure 3 provides context for these findings, showing the distribution of PE across participants' photos. Table 2 outlines the final decisions and rationale for each participant, with the majority, n equals 7, deciding to share their data. The study's findings underscore the importance of considering PE in data sharing decisions. Participants who employed privacy strategies during data collection, such as P5 and P8, had fewer instances of PII in their photos. Those who reviewed their data with a cited family member, like P4, were more likely to identify and address potential PE concerns. The annotation process and findings from this study contribute to the understanding of PII in data sharing and highlight the need for careful consideration of privacy concerns. The use of the VGG annotator tool and the introduction of a new category, other flag, demonstrate the importance of adapting annotation tools to accommodate specific research needs. Limitations include the reliance on self-reported data and potential biases in the annotation process. Future work could involve exploring the use of automated annotation tools and investigating the impact of PE on data sharing decisions in different contexts. This section of the research paper delves into participants' decisions regarding data sharing and privacy concerns, as well as the perceived value of their study data. The analysis reveals that the presence of personally identifiable information, PE, in photos significantly influences participants' willingness to share their data. For instance, 4% of P5's photos included a letter capturing both the sender's and receiver's information, while 4% of P8's photos captured a fully visible face of a family member. These findings led to changes in sharing decisions for both participants. The perceived quality of the data also played a crucial role in participants' decisions. Most participants, all except P3, P4, P6, P7, were hesitant to share bad photos, which they believed could interfere with the research. However, the value of datasets is relative to the needs and contexts of the models that the data support. Real-world photos captured by blind users and sent to object recognition systems may include elements like out-of-frame or blurred objects, making datasets that are shared most helpful when they match these real-world scenarios. The study also explores how and when participants communicated their decisions. Some participants, P2, P8, P9, indicated their decision informally during the interview study, while others, P2, P3, chose to provide written consent by responding to an email. The majority, n=8, of the participants opted for verbal consent only, which they conveyed during the co-design session. Interestingly, those who opted out of the co-design study altogether, n=3, did not respond back to the consent email, suggesting that emails may not be an effective approach for data stewards to obtain written consents from blind data contributors. Blind participants' decision-making processes in data sharing were investigated, with a focus on the role of AccessShare, a co-designed data access and sharing system. The study found that participants' decisions were influenced by various factors, including the potential benefits and risks associated with sharing their study data. Notably, the addition of AccessShare facilitated the communication of data sharing perspectives and decisions across participants. The interactive nature of the study enabled participants to articulate their concerns and preferences regarding data sharing. Specifically, the findings indicate that participants weighed the potential benefits of data sharing, such as contributing to scientific progress and improving healthcare outcomes, against the potential risks, including loss of control over personal data and potential misuse. The study employed a mixed methods approach, combining qualitative and quantitative data collection and analysis methods. This allowed for a comprehensive understanding of participants' decision-making processes and the role of AccessShare in facilitating data sharing. The results highlight the importance of considering the needs and concerns of blind participants in data sharing decisions, and demonstrate the potential of AccessShare as a tool for facilitating informed decision-making. The study's findings have implications for the development of data sharing systems that prioritize accessibility and participant-centered design. Furthermore, the results underscore the need for ongoing research into the complex factors influencing data sharing decisions among diverse populations. Limitations of the study include the small sample size and the reliance on self-reported data, highlighting the need for future research to validate and expand upon these findings. The AccessShare platform, designed to facilitate photo collection and review for object recognition in machine learning models, has yielded valuable insights into user experience and suggested improvements. Users found the platform's navigation and structure to be accessible and appreciated the guidance provided. However, they identified limitations, particularly regarding descriptor ambiguity, such as face presence and more than one object detected. To address these concerns, users proposed introducing filters and sorting functionalities to better inspect photos flagged for concerns, especially those with face presence. Editing and deleting functionalities were also suggested to refine labeled photo collections, including grouping potentially problematic photos for verification and correction of classification errors or removal of personally identifiable information, (p), or unwanted characteristics. Participants recommended enhancing descriptors with contextual information about the background, objects, and evaluation of photos. This includes specifying the number of objects detected, detecting tattoos as identifiable information, and providing dimensions and colors of objects. Additionally, users expressed interest in verbosity controls over descriptors, allowing them to toggle certain descriptors on or off according to their preferences. Notably, half of the participants desired increased control over descriptor verbosity, highlighting the need for adaptable and user-centric design in machine learning model development. These findings emphasize the importance of user feedback in refining platforms like AccessShare and highlight opportunities for improvement in photo collection, review, and descriptor design. Blind individuals face unique challenges when accessing and sharing their study data, particularly when relying on sighted assistance. A recent study investigated the views of blind participants regarding multi-user access to their study data, highlighting the importance of independence and autonomy. Prior to a co-design session, most participants interacted with their study data independently, with only one participant seeking sighted help from a family member. However, several participants expressed concerns about relying on sighted help, citing potential hindrances to their independence and the difficulty of finding trusted assistance. When asked about design features that enable access to peripheral users, such as chosen sighted help, Half of the participants deemed it unnecessary or raised concerns about relying on someone's availability. Some participants noted the difficulty of finding trusted cited help, with one participant preferring to review data themselves, even if it meant incomplete knowledge of the content. The study also explored the trade-off between accuracy and speed in data interpretation, revealing divided opinions among participants. Some prioritized accuracy, even if it meant waiting for manually annotated descriptors, while others opted for speed, citing the importance of maintaining continuity within the study context and receiving immediate feedback. A few participants suggested employing alternative technologies, such as text recognition, to complement photo captioning methods or prioritizing the sharing of quality over quantity to reduce the volume of photos reviewed and shared. The discussion underscores the importance of informed consent and meaningful data control for blind individuals when sharing their data via a public AI dataset. Notably, most participants preferred verbal consent during study sessions after data collection, and there is a need for a more interactive and accessible consent process. The study's key insights can inform future participatory data stewardship efforts and the implementation of systems supporting data access and control. The importance of engaging blind individuals in contributing to datasets for AI innovation is emphasized, with a need for inclusive and accessible data stewarding processes that prioritize their needs and preferences. Interactive informed consent is crucial for blind individuals sharing study data, as it enables dialogue with researchers to discuss concerns and make informed decisions. This approach yields a more nuanced understanding of participants' needs and expectations. Blind participants value the opportunity to interact with researchers, leading to a more solidified decision on data sharing. However, this approach raises questions about the role of researchers and potential power imbalances. To address this, establishing and communicating alternatives with potential data contributors is essential, which is currently lacking in AI research. Considering the needs and expectations of blind individuals is vital when designing data sharing platforms. A delicate balance between independence and seeking cited help is sought by participants. To achieve this, incorporating features such as commenting functionality for each photo to address uncertainties or concerns is recommended. Enhancing data descriptors and inspection methods, including AI-infused capabilities like alt text captioning and text recognition, is also suggested. Furthermore, verbosity controls and multi-user data access, including acknowledging the negotiation process between blind and sighted users, are necessary. Revisiting the concept of consent as a shared multi-user decision is crucial, addressing power dynamics and potential misuse. This emphasizes the importance of interactive informed consent and user-centered design in developing accessible data sharing platforms for blind individuals. The AccessShare co-design study's limitations and future challenges are discussed in Section 7.3 of the paper. The authors acknowledge that their observations are based on a small sample size of 10 blind participants, which, although diverse in terms of age and balanced between women and men, tends to have higher education backgrounds. This may limit the generalizability of the findings, particularly given the study's remote nature and recruitment from a relatively small area in the U.S. near the author's institution. Furthermore, recruiting participants from the lab's mailing list may have introduced bias, as they may have been familiar with the research team and the concept of consent. The authors caution that their approach, while useful for gaining insights from the blind community, is limited as a practical tool for data stewards seeking to obtain informed consent from blind participants. The process was lengthy, requiring multiple individual meetings with participants, which could be prohibitive with a larger sample size. Alternative approaches, such as obtaining consent via written or verbal means during or between co-design sessions, may be considered, but interpreting these findings requires caution due to potential order effects. The authors highlight the challenge of controlling participants' study data over time, as they did not receive any responses from participants after the study to revoke their consent. Implementing mechanisms for ongoing reassessment and consent is crucial, but practical challenges remain, such as determining who tracks consent over time and whether consent ever expires. These challenges are particularly relevant in long-term engagement, where researchers must rethink their approach to research and consider dynamic consent practices that involve bidirectional, continuous, and interactive communication between researchers and participants. The authors also discuss potential biases in their study and probe design, including the zoom setup during data collection, which may have inflated the cases of personally identifiable information, (p) in the photos taken by participants using smartglasses. Additionally, the data descriptors in the AccessShare probe may have misled participants into seeing AccessShare as a reflection tool to improve the smartglasses application. Key findings of the study include the impact of an interactive consent approach and the complementary nature of AccessShare in facilitating communication between data stewards and blind data contributors. Design opportunities for data inspection and control functionalities are also highlighted, as well as the need to consider nuanced viewpoints on independence and interdependence in decision-making when designing multi-user data access. Future work will focus on making the dataset available to the broader research community and integrating participant consent and feedback into data sharing practices. Visually impaired individuals increasingly rely on camera-based assistive technologies, such as text detection and recognition on handheld objects, to aid in daily activities. However, this reliance raises significant ethical concerns related to privacy and data protection. Understanding the privacy implications of these technologies is crucial, as they can potentially compromise sensitive information. The study investigates the privacy concerns of visually impaired individuals who use camera-based assistive technologies. It highlights that these technologies can inadvertently capture and process sensitive information, such as personal data, financial information, and health records. Furthermore, the data collected by these devices may be transmitted to third-party servers for processing, potentially compromising user anonymity. The researchers employ a qualitative approach, conducting in-depth interviews with visually impaired individuals who use camera-based assistive technologies. The study reveals that participants are often unaware of the data collection practices and privacy policies associated with these devices. Moreover, they express concerns about the potential misuse of their personal data and the lack of control over their information. The study proposes a framework for addressing the privacy concerns of visually impaired individuals who use camera-based assistive technologies. The framework emphasizes the importance of transparency, user consent, and data minimization. It also suggests that developers of these technologies should implement robust data protection measures, such as encryption and secure data storage, to safeguard user information. The findings of this study have significant implications for the development of camera-based assistive technologies. Developers must prioritize transparency, user consent, and data protection to ensure that these technologies are both accessible and private. The study also highlights the need for further research on the privacy concerns of visually impaired individuals and the development of effective solutions to address these concerns. Please go ahead and provide the transcript that needs refining. I'll get started on transforming it into a direct, concise, and technically accurate summary suitable for voiceover narration. Please provide the original text you'd like me to refine, and I'll create a concise, technically accurate summary suitable for voiceover narration. I'll ensure that the refined text maintains the technical depth and accuracy of the original content, while adhering to the guidelines you've outlined.